All right, so this is for MN669 Journal Week 8. Week 8? Can't believe it. Okay, so when you experience significant event, patient interaction never seen before. I'm pretty much done with my hours, but a diagnoses that kind of I remember during my preceptor or my clinical hours was a 19-year-old that came in and wanted to come off of the Adderall. He was in college and said that he had been experiencing not taking it, and felt like his concentration was good. He said he did feel a change, but that he was able to bring himself back to his studying. And so my preceptor was like, I think it's good that you're experimenting with it. You've been on it for some time, on and off, especially for school, and explain to him some of those symptoms of not having good concentration when things start to fail his school, his relationships, or he's feeling like he's antsy. Just really explain what DHD symptoms are and why he was placed on the medication, and not telling him, you really need to take it or this is going to happen. It was more like, it's your body, it's your option. But I think that he told him, I think that you should do some therapy while you're decreasing the meds and see me a little bit more often, so you have more eyes on you saying, hey, I think, this is going great, or I see some of these symptoms that we should really start to target before things get out of hand. And he totally agreed. I thought that was pretty neat. Definitely don't want people on medications if they themselves feel like, hey, I really want to try to control it. I know there's some that there's just, you worry about them, but it's their choice. I like the option of, hey, counseling, see me a little bit more often, have, professional eyes on the patient to say, I'm starting to see this, you're starting to express this, before, 2-month follow-up or 2-week follow-up or a month follow-up and things are chaotic. And then you can choose the same case. Okay, discuss the impact this had on you in terms of increasing your understanding. Remembering that, yes, there's protocols. Yes, there's recommendations, the DSM-5, there's all of our research, but at the end of the day, it's the patient that leads the care. And that we have that relationship with them to say, this is what you want to do, educate them so they make the best educated decision for their health care. Explore your personal strengths and limitations and their effect on the provider-patient relationship. So strengths are, I agree with patients that want to try to do things naturally, because they're